Good afternoon and welcome to the City of Toronto's COVID-19 media briefing. Today we're joined by our Medical Officer of Health, Dr. Eileen de Villa. Please go ahead, Dr. de Villa.
Thank you, Lenore, and good afternoon, everyone. Today, there are 33 new COVID-19 infections in Toronto. To date, 14,401 people have recovered, an increase of 32 since yesterday. These lower case counts are good news, but we are still seeing new infections reported daily in the double digits. Over the last week, we've seen 198 new infections in our city. The virus is still here, and this emphasizes why we need to be careful and to keep following our public health measures. Wear your mask, wash your hands, keep 6 feet apart from others. We are at a critical time in the pandemic, and I need your help. I'm asking you to listen and to take note so you can help protect each other, so we don't lose our progress in fighting this virus. We're going to be living with this virus for the foreseeable future, so it's critical that everyone understands that this is a marathon and not a sprint. We still have a long road ahead of us, and we need to be careful. In a perfect world, we'd see a decline until we have no new cases. This is not feasible right now, given the size of our city, how contagious the virus is, and because work is still underway to develop effective treatments, but this work is not done yet. We can still keep learning from what is happening in other cities to do better and to keep our numbers low. And most importantly, we can keep trying our very best to keep taking care of each other. As we look at cities in Western Canada, in the US, and around the world, we are reminded every day that this pandemic is not over. In British Columbia and in Alberta, there are increased COVID-19 case numbers and hospitalizations linked to social gatherings. As people start to move around and travel again, places that had low case counts earlier this year are experiencing their biggest daily case counts since April. This is very concerning. The reality is that there are many months of this pandemic still ahead of us. As we learn to live with this virus, our goal here in Toronto continues to be clear. We all need to do our very best to minimize the onset of new cases. Throughout this pandemic, my public health colleagues and I have urged you all to wash your hands, to keep your distance, and to wear your masks. These 3 simple steps are absolutely critical if we want to minimize COVID-19 spread in the months ahead. Just as I asked at the beginning of this pandemic, I'm calling on everyone to do absolutely everything you can to keep reducing the spread of the virus. This means washing your hands, watching your distance, wearing your mask, and staying home when you're sick. I know that this has been a difficult year, and like no other time we've experienced in our lifetime. I think it's safe to say that we all think about how different our lives were at this time last year. I know I do. However, it is important to find enjoyment and joy in these unprecedented times. And as part of my update today, I would like to talk about safe socializing during COVID-19. It's important that we all understand the difference between a social bubble or social circle and physically distanced socializing, and what our new normal looks like until we have a treatment or vaccine for this virus. Since reopening, I continue to hear firsthand that people believe we can now go back to normal. I also hear that there is confusion on what safe socializing looks like and whether we still need to take precautions when connecting with our friends and our families in person. We know from observing other cities around the world that unless we all embrace personal responsibility to keep our distance from others outside our social bubble and wear our masks, we will see increased COVID-19 infections in our city. We've come a long way together to get our numbers to the low double-digit range, thanks to your commitment. But your actions now will affect COVID-19 activity in the weeks and months ahead, throughout the late fall and into the winter. So I ask that you please listen carefully. Connecting regularly with family and friends is a cornerstone of our overall health and well-being. Throughout this pandemic, I've strongly encouraged all of you to connect with each other and to take care of each other. So I'd like to remind everyone of a few key points about social bubbles or social circles. First of all, if you belong to a particular social bubble, it's 10 people or less. You can hang out with this group with masks or without masks, indoors and outdoors. And you can hug people within your social bubble. You can have that physical closeness. You must have agreement with everyone in this bubble to keep a distance from others outside the bubble, to keep everyone safe. It is critical to remember that you can only belong to one bubble. This means that if you're socializing with friends and family from outside of your bubble, you must keep a distance of 6 feet from them. Socializing safely with others outside of your bubble includes meeting in a park or getting together in someone's backyard. At a distance, of course. And for those brief moments where you can't maintain a safe distance, please wear your mask. I know that this year is not the same as other summers in the city, but we can still have fun. The other day, my husband and I were invited to a friend's house for a physically distanced visit in their backyard. We hadn't seen them for a very long time, and it was really nice to spend some time together and catch up. But I will admit that it did feel strange keeping at least 6 feet apart and not being able to hug them. I realize that socializing during a pandemic is difficult and maybe even awkward for some. We're used to hugging our friends when we greet them and sitting close to each other around a table to share a meal or a drink together. However, we're still learning to live with a highly contagious virus that is deadly for some and that has profound, lifelong impacts for others. We know we will have more COVID-19 activity in our city. The only way we will minimize our risk is if we all keep doing our part. So please, be careful and keep protecting each other. I want to take this opportunity to thank, once again, the members of our city's media for coming together and ensuring that the public has the information they need to keep safe. As I've said many times before, I sincerely appreciate your help in sharing these important and time-sensitive messages with our public. So in closing, as you are outside enjoying these last days of summer, I ask that you please continue to wash your hands, wear your masks, watch your distance, and take care of each other so that we can get through this together. I'll now turn it back to Lenore and would be very happy to take any questions.
Thank you, Dr. de Villa. We'll now take questions. As a reminder, each media representative can ask one question and one follow-up. Before we get to your questions, we have staff on the line who can also answer your questions. First up, we have Dave Ryder with the Toronto Star. Go ahead, Dave.
I'm just asking, I guess the first question is just about the change in tone. When the Star and others noted in recent days that Toronto infection rates seem to be climbing slowly but steadily back up after a long decline, I think what we heard from public health was concern, but this was expected. Today, you sound a little more, I don't know, dire isn't the word, but you sound a little more concerned. Is there any particular reason why, or is it just looking at the numbers? And I noted that the indicator for Toronto has turned yellow on the Toronto Public Health dashboard.
So thanks, David. I appreciate the question. Certainly dire is not the tone I'm seeking to convey, but there is, of course, concern. We have been seeing our numbers stay in that low double-digit range, and we know that as children return to school and as schools reopen and as we see more activity, more intermingling between people, we should expect that there will be an increase in COVID-19 activity. I think the challenge in front of us is how best we control this, how best we minimize the risk to our city. And I just want to emphasize that it actually rests on all of us to continue doing our part. I am seeing, here in our city, and we have seen elsewhere in other parts of the country and in other jurisdictions further afield, that there is a certain sense that we're back to normal, that we needn't follow all these public health measures. And perhaps that's what you're sensing from me today. It's concern that there is a sense of returning to normal life, to the way things were in terms of interacting with each other. And in fact, that's not the case. We need to continue to be vigilant. We need to continue to practice those public health measures. It is about continuing to watch that distance, to wear masks, especially when that distance can't be maintained, to wash our hands, to stay home when we're sick, and to be vigilant, recognizing that COVID-19 is still very much in our community and still poses a threat to the health of many in our city.
Did you have a follow-up, Dave?
Yes. A follow-up question is, I noticed some research talking about people in other countries being reinfected and not being immune from getting the disease. I'm wondering if you have any comment on that, and also if there's any other emerging research that you're watching as Toronto moves towards the fall and school and an expected increase in infections.
So I think we're constantly watching the research in respect of COVID-19. And as I've said many times, this is a new virus, one that we have only recently come to know. Early January was when the virus was first sequenced. We have learned much over the past 8 months, but I think we recognize that there is still much more by way of learning that needs to occur. This notion of immunity, duration of immunity, can you get reinfected, is still very much a question. I admit I haven't looked into the specifics of that recent research around reinfection. I believe it was a study produced in Hong Kong, or a report of a case in Hong Kong. We know that there are a number of studies with COVID-19 that are being put out there before peer review. So I think we have to look at these studies extremely carefully. I think we're trying to put science out there earlier or as early as possible. And so sometimes things don't go through quite the same rigorous review as they normally do in order to get published. That doesn't mean that they're not valid. It just means that we need to look at them very, very carefully and understand what the circumstances are before we land any conclusions or come to any conclusions on the basis of those studies. Science is a very careful process, and it does rely very heavily on peer review and ensuring that appropriate methodology is being followed before you can actually land particular conclusions. I think that's, if there's something I can say about COVID-19, it's that it has been something that has taught us about how humble we need to be as we learn about new and emerging infectious diseases. There's still much learning that we have to do.
Our last question today goes to Miranda Anthistle with Global TV. Go ahead, Miranda.
Hi, thanks for taking my questions. They are for Ms. Bedard, if she's still on the line. And they're in regards to the temporary shelters that have been set up. One of them at the Strathcona Hotel at York and Wellington, and the other one at the Delta Hotel near Kennedy and the 401. We're hearing from residents who have a number of concerns, so much so that they've actually had the property managers write letters to the cities saying that they just don't feel safe anymore in their homes and in their neighborhoods because of the shelters. Some say they've been accosted by shelter residents. Others say there's been property damage and an increase in crime. They also say they were never consulted or informed by the city that this would be put in their neighborhood and in their backyards. So I'm wondering if you can tell me why businesses, why residents were never consulted, and how is the city addressing residents' concerns about their safety in relation to the shelters?
Thank you very much for the question, and it's a very important one because we've certainly been hearing information like this from across the city. I mean, I think the first thing to remember is that choosing where to put shelter locations is a decision that's made by staff. It was delegated to staff by council 2 years ago because it is a difficult decision, and there are lots of things that need to take into consideration. And unfortunately, it is not a public decision. But I think where we are very interested in engaging with communities is on the issues that they are experiencing. It's really important to understand that it doesn't help necessarily just to move locations when an area experiences some problems, but actually to work with the local area on what those specific issues are and to try to solve those. We are seeing an increase in homelessness in Toronto. We have had an increase of concerns from people, primarily because we've had to open about 30 new locations in 6 months. That sort of rapid expansion has made it difficult to consult prior to opening programs with communities, but we are undertaking that work now, and we look forward to working with the community and with local councillors to address people's concern.
Thank you, Marianne. Miranda, did you have a follow-up?
Yes, I did. Thank you so much for that answer. And my next question also has to do with the shelters. The residents that we have been hearing from and speaking to say they don't have an issue with, the people experiencing homelessness. It's more about the mental health issues that they're having, I guess, problems with. And they say, these are supposed to be temporary shelters. So my question is, what is the city doing to, A, address the issue of mental health issues at these temporary shelters, and what are the more permanent solutions being looked at for housing?
Yeah, thank you very much. That's also a very helpful question, and that is along the lines of what we hear. When people call with concerns, they're actually not calling about concerns with homelessness, but more the roots of homelessness. What are the reasons that cause people to become homeless? And as you know, mental health is a provincially regulated health service. So although the City of Toronto does provide shelter for people who don't have a home, we work in collaboration and coordination with the province to ensure that people have access to adequate mental health and addiction supports. So we'll continue to do that work and continue to advocate that there is appropriate, available support for people who are experiencing mental health issues.
Thank you, Marianne. That's it for today, everyone. Our next media briefing will be on Monday, August the 31st. Thank you, everyone, and have a great afternoon.